Good afternoon, everyone. My name is Elise Hummel-Vitale, and I'm a Senior Advocate with California Food Policy Advocates. Welcome to the CalFresh and WIC Better Together webinar. This webinar is hosted by CFPA with generous funding from the David and Lucille Packard Foundation. We have a very full agenda today, so I'm going to go ahead and get us started. Let's see if I can move along the slides. Good. Okay, so before we get into our presentations, a few quick tips about how to participate in this webinar. As a reminder, you may listen to this webinar through your computer speakers or by telephone. If you're having trouble with your computer speakers, the registration email you received does contain the phone number. We have lots of attendees today, so everyone is muted and will remain muted throughout the webinar. If you have a question, please submit it in your GoToWebinar control panel under the Questions tab. In fact, we encourage you to submit your questions for the presenters as we go along. At the end of the presentations, we will save about 10 minutes to hopefully answer most if not all of your questions. We are recording this webinar and it will be posted on CFPA.net along with a PDF of the slides. I know that's often a common question. Excuse me. You may have already noticed that there is a handouts tab on your control panel. You'll find a few additional resources already posted there for you. And then lastly, if you're not already, please make sure to sign up for CFPA's Nutrition Action Alert at cfpa.net/subscribe to stay up to date on our work and forthcoming materials. So I'd like to take a moment to see who is in our virtual room. I'm going to launch a quick poll to see what kind of organizations are represented here today. Let's see if I can do it. There we go. So you should have a poll that pops up in front of you onto your screen. And the answers are coming in. This is really helpful for us as presenters so we know who is in the room today. We'll take just a few more moments here. And the votes are coming in. Okay, so I'm going to close the poll. Let's see if I can share the results too. So it looks like we have a real diverse crowd today. We have some WIC administrators, about a quarter. Another 20% of you are CalFresh administrators. We have a few advocates in the room like myself. We have some social service or community-based nonprofits, and then another quarter of you are other. So maybe I should have better distributed the groups and thought about some other folks, but hopefully we're able to address all of the things that you guys are thinking about and working on today. Okay, so I'm going to hide the results and go back to the presentation. There we go. Okay, so it will be of little surprise to most of you that the basic cost of raising a family here in California often far exceeds the annual income of full-time working parents. With limited resources, low-income families are commonly forced to make really tough decisions between basic necessities. Will I pay the electricity bill this month or buy some additional groceries? Despite an increase to California's minimum wage and a booming economy, our state is increasingly being divided into two, those who have and those who have not. As you'll see on this slide, an individual working a 40-hour-a-week job at minimum wage makes just over $20,000 a year. The median comprehensive income, which includes earned income and other sources of financial support for young families or families with young children here in California, is about $52,000 annually. Whereas on average, it's costing California families with young children between $67,000 and $73,000 each year. But nutrition assistance programs can help. They can help alleviate some of the burden felt here in California with the unbearably high cost of living, and it can help alleviate the immediate issue of hunger. The Special Supplemental Nutrition Program for Women, Infants, and Children, more commonly known as WIC, provides food, referrals, breastfeeding support, nutrition education, and more. Excuse me. In March 2017, more than 1 million women, infants, and children participated in California's WIC program. receiving on average about $62 a month through the food package and rebates. Despite a strong statewide WIC coverage rate, county-level data indicates that there are a handful of high-performing counties that mask low coverage rates elsewhere, and we know that nationally and here in California, WIC participation rates are declining. CalFresh, known federally as SNAP, also provides a monthly benefit to low-income households for food purchases. CalFresh is particularly important and effective at helping young families put nutritious food on the table and lifting low-income families out of poverty. Annually, between 2009 and 2012, CalFresh kept more than 800,000 people out of poverty in California, including 417,000 children. CalFresh benefits, however, are modest. The average monthly CalFresh benefit for families with children is only about $382, about $1.52 per person per meal. But when young families are able to access both WIC and CalFresh, we see really strong outcomes. The average monthly value of the two programs combined is equal to $443. Furthermore, additional grocery dollars leads to healthier diets. Economists have recently found that increasing SNAP recipients' food budgets by just $30 per person a month would reduce food insecurity and increase consumption of nutritious food while decreasing consumption of fast food. So with a few extra dollars each month for groceries, families can purchase the healthy foods they need. And contrary to common belief, we now know that when WIC families also access CalFresh, they are more likely to continue engaging with WIC staff and accessing the multitude of benefits that come along with the public health program. So recognizing the importance of bringing the benefits of WIC and CalFresh to young families, CFPA has been exploring ways to make the programs more streamlined and easier for families to enroll in at the same time. We recently put out a new report which lays out a vision where all of California's women and young children are healthy and stable as a result of having the resources they need to access and consume a healthy diet, and where the state of California leads the way in creating nutrition programs that are client-centered, easy to access and navigate, and coordinated with other supports for best outcomes. CFPA believes that there is a unique and timely opportunity for California to help young families connect to more streamlined nutrition assistance programs, and that this can happen by engaging communities, establishing standards to address inequities and inconsistencies across counties, and by leveraging technology to advance client-centered programs. I hope you will download the report, consider the recommendations, get in touch with me to further discuss, and also listen closely today to learn more about emerging practices and opportunities. So without further ado, I'd like to introduce our next presenters. First, you'll hear from Christine Nelson, the Chief of the WIC Division in the California Department of Public Health since 2014. And then we'll hear from Kim McCoy-Wade, who was appointed Chief of the CalFresh branch at the California Department of Social Services in 2015 and previously worked as an independent consultant and for the California Association of Food Banks. So I'm going to unmute our panelists. Give me 1 second here. Christine, can we hear you now?
Yes, hi, good afternoon.
Hi, great, go ahead.
All right, good. Okay, so if you could advance to the first slide, I'll give a little bit of an overview of what WIC at the state level has been working with the CalFresh branch over in social services. So it's starting in 2016, we began a collaborative project with WIC and CalFresh. We wanted to do a data linkage and between WIC participant information and CalFresh participant information. And then also we wanted to visit areas within the state and interview staff and participants to find out about experiences in both participating in both programs. And also our last piece is to look at some education materials that we could do, communication messages, things that we could do to reduce barriers and improve participation in both programs. And in WIC, we were focusing on children because we do a good job enrolling pregnant women in the program. We'd like to get them earlier in their pregnancy, but we do have pretty high coverage rates for pregnant women and infants. But as children get older, we have lower coverage rates there. So our focus in the WIC program was on children. And so just a little bit of a background for those of you that may not be as familiar with the WIC program. We serve children up to their 5th birthday. So once a child turns 5, they're no longer eligible for the program. So we are really targeting very young families there. So next slide, please. This is a map that I'll walk you through a little bit here at a high level. So we did complete the data match. We pulled WIC participant data and CalFresh participant data from March of 2016 and did a linkage to see what percentage of WIC participants were also in CalFresh and then also vice versa. So this particular map is looking at the percentage of WIC infants and children that are also in CalFresh. Now it's important to note that a high percentage might be a little bit misleading because if both programs have low coverage rates for their individual programs, it might be those few people that are in WIC are also the few people that are in CalFresh, which would then give a high dual enrollment number, but it's actually a little bit misleading because there is room to grow on both sides. So that's just something to keep in mind as we look at this. So what we did find, though, at the state average is that 41% of the infants and children in WIC were also in CalFresh. And I have to say I was a little surprised. I thought I expected the number to be a little bit higher, but WIC has a higher income threshold than CalFresh does. So there are a number of infants and children that would not be eligible for CalFresh. So we're never going to get the WIC percentage to be at 100%. And as you can see, there's a variation across the state. And there is also a map that CalFresh has of the complement of this that shows the percent of CalFresh that are in WIC. And that number, that statewide average, was higher than 41%. It was in the high 60s. And so that doesn't, so again, considering the income threshold is higher for WIC, it's not a surprise that the percentage for 68. So 68% of the CalFresh children are also in WIC. So again, it's not a surprise that CalFresh percentage would be a little bit higher there. Next slide, please. Then another map that we created, we looked at the number of WIC eligible participants that are eligible for WIC but not in WIC, and if they are in CalFresh. So these are, again, these are in CalFresh but not in WIC, but it's the raw numbers, it's not the percentage. So this is the map that I think our WIC local agencies are using more often because it tells the actual number of people that they might be able to target. And I'm going to highlight Los Angeles in red. Not surprising that Los Angeles has the highest number of people. They might have a higher dual enrollment rate than other counties between WIC and CalFresh, but just by the sheer numbers of people, they're going to have the highest number of people. And I know there's a presenter from a team from the Los Angeles area that's going to talk a little bit more in detail about this, but their number of 40,000 comes from this red area of LA County right there. We also have, in addition to this map that just shows the county outline, we do have dot density maps that show individual people that has much more detail of this, and we only provided those to our local agencies because it does have confidential data. So we are not releasing that publicly because you could identify where a particular individual lives that's in the WIC program, and that's not something that we are releasing publicly. So our WIC local agencies have a lot more detail in this so that they can use this information and how they target their outreach practices, where they might go to say there's a cluster of people here in a certain community that is in CalFresh but not in WIC, and so maybe we need to do some different work there.
Great.
If you could go back to, go ahead. No, is there a question? No? Okay. If you could go back to the first slide, then I'll give a little bit of more information on the other activities that we did. So those two slides about the states are about Objective 1. In Objective 2, we did visit WIC local agencies in Sacramento and Fresno, and CalFresh folks came along with us, and then we did eventually did the opposite, where we visited CalFresh sites and the WIC folks went along. At that time, one of the reasons that we picked Sacramento and Fresno is because there were other outside organizations that were doing the same type of work that were visiting agencies. So they visited the Bay Area and Southern California. We didn't want to inundate our local agencies and having multiple teams come and ask similar questions and interview their staff and participants. So that's why the state focused on Sacramento and Fresno. And we did gather good information about why people might have stayed in WIC and not moved to CalFresh or vice versa. Heard lots of good things about participating in both programs, which was really helpful. Some misinformation about why people might be in one and not the other when they were eligible for both. And then the last piece, and I think Kim McCoy-Wade is going to talk a little bit more about next steps, about some projects that we have in the works about education materials, working with Medi-Cal as well. So with that, I'm going to pause and see if there's a question.
No, we're going to, Chris, this is Elise. We're going to hold all questions to the end. I just thought, okay. I wasn't sure if you were finished.
Sure. No, that's fine. I think I'm good. I'll pass the mic off to Kim, and then we'll be available to end if there's any questions about.
Great. Thanks so much for your time. So Kim, I will advance to your slides, and so you know that I have included 2 maps for you as well.
Oh, thank you, Elise. Good afternoon. This is Kim McCoy-Wade from the CalFresh branch, and just want to build on what Christine already said about our partnership, that we did begin with that legal data sharing agreement, and then used our respective data scientists to do that data match and produce the maps. And now we're really excited to be turning to the phase of using the data to drive program and drive outcomes. So I just wanted to quickly lift up three avenues that we're walking down. One, as Christine just demonstrated, we are sharing these maps with local agencies and outreach partners and stakeholders. In CalFresh, I hope you've already discovered the CalFresh data dashboard, and you can find CalFresh WIC data in 2 places. One, on the data dashboard, there's a dual participation button you can push, which has some bar charts on Medi-Cal CalFresh and WIC CalFresh. And then there's also a button called GeoMaps, where you can find more of the maps that we've just seen, and we're going to show you some more, where you can look at some of those numbers of kids who we think the number of WIC recipients who might be likely reachable. So we're encouraging folks to use those in their planning, our local outreach contractors, as well as counties and other stakeholders, to really use that to focus and measure progress in reaching young children. The second thing we're doing is having more conversations like the folks you're going to hear from next, local county social services and local WIC agencies, about what they want to do and what are the kind of things we should be testing. So we're very excited to hear about all the different ways that we can go really build on the relationship, the strong relationship that many WIC and CalFresh agencies already have, but truly to go beyond referral to get to that enrollment and retention piece. How can we do more in our warm handoffs, in our customer service, in our follow-up, to make that connection as seamless and easy as possible for our moms and families? So that's something I'm just going to pause there, but hope that when you hear from LA and Sonoma, it sparks more ideas, and you give more requests to us and my colleagues at CDPH about how we can facilitate you experimenting, support it, and scale those successful interventions that drive the numbers. And then thirdly, I just want to say there's been a lot of popularity around this idea of the welcome new baby. In Medi-Cal, babies are added to Medi-Cal cases pretty quickly, and that's one of the first ways that county social services knows of a new baby. And we're working with our WIC partners on, is there a way we can reach out to that family and say, congratulations, welcome. These nutrition resources are there for your baby and your family, and really do a dual message of WIC and CalFresh at that critical first couple months And again, have it be a streamlined, easy, particularly for these new parents, right? An easy, warm enrollment process in both of our programs. So we would like to develop at the state level some great messages, toolkits that could be postcards or text messages or various ways you could give that welcome baby message connecting to nutrition. And the goal here is to see if we can catch kids that's enrolled sooner. Some of the data shows that there's a little bit of a lag, especially in CalFresh. The kids aren't coming on our program till they're 1 or 2 or 3, and we want to see if we can bring them into the program, get that nutrition benefit for their whole family, that income support for their whole family right from the start. And I know WIC wants to do the same. So we're exploring if we can develop materials and that can be easily replicated and welcome people's ideas on this, interest in that. If you tried something like this, we're especially interested to see what messages work. I was out in a county a smaller county that had a tradition of doing baby showers for new babies, where that kind of a fair where all resources were available to parents. So we know there's been some work in this area and are eager to learn the lessons and replicate. So those are kind of 3 ideas we have: pushing the maps out, encouraging more test pilots, and providing some state resources to make it easy to try this dual outreach. And look forward to hearing more ideas come out of this call and how we can support. Elise, you want to show a couple of the maps just to give people a preview? So this is kind of the reverse of WIC recipients not participating in CalFresh. You'll see that one of the things our research scientists did to try to get at the fact that Christine alluded to, that the programs don't have the same eligibility rules, is we came up with this concept of reachable for CalFresh, which really means the lowest income WIC children and families that we have some certainty are income eligible for CalFresh. We just deemed those reachable, again, to set goals that we think are realistic rather than the 100% goal, when we know some WIC kids aren't going to qualify for CalFresh, but many of them are, and we wanted to give us a flavor of that. So that's that map. And then here, again, looking at CalFresh recipients 0 to 4, how many of them are also enrolled in WIC? We have quite a range. And again, this has demographic factors, economic factors, program integration factors, all kinds of things driving it. It's just a data point to help you understand, or provide one more data point of the picture of what's happening locally, so that we can increase the number of CalFresh recipients enrolled in WIC.
Thank you so much, Christine and Kim, for taking the time to share with us what the state is working on. So next I'm going to pass it over to my colleague, Jared Call.
Thanks so much, Elise. Yes, I'm Jared Call with California Food Policy Advocates, and in my capacity at CFPA, I help lead our organization's work to improve access and participation in CalFresh. So obviously very interested in the topic here today, and I also help lead our federal advocacy efforts. So we've heard today from Christine and Kim, our state partners, about their goals around cross-enrollment and some of the opportunities and tools that they've helped develop to help local partners achieve those goals. But as Kim highlighted so well, we do think it's really important to lift up some of the promising practices and emerging practices at the local level, and so we're going to hear about a couple of those today, hoping that that those can be adopted by other local WIC and CalFresh agencies, and with support from our state partners, in some cases scaled up to a statewide level. So I'm based in LA, in Los Angeles, so I've been really fortunate for the past few years to work with 2 of our next presenters, the LA County Department of Public Social Services and the Public Health Foundation Enterprises WIC program, or PHFE-WIC. So we've got Kiran, Maria, and Carlos today to talk about some innovative things that they've been doing to support cross-enrollment or co-enrollment of WIC and CalFresh through co-location of enrollment workers at a number of sites, including many of the local farmers markets that we have here in LA, which you'll hear a lot about. And it's been a very successful collaboration. I want to highlight that it has been lifted up by the County Board of Supervisors as a real success story. The Board of Supervisors here in LA recently passed a motion encouraging the Department of Social Services to set some really ambitious targets to improve their participation rate by 20% over the next 2 years. And so there have been some really great innovative thinking from the department and some innovative partnerships to help achieve that laudable goal. And one of them is what we're highlighting here today with PHFE and DPSS. So after we hear from DPSS and PHFE, we'll hear from Tracy Barrow in Sonoma County, who will describe a local data sharing agreement through a memorandum of understanding that county has engaged in to help identify very likely dual eligible families. But first, I'd like to introduce Kiran Saluja, the Executive Director of PHFE-WIC, and then she'll turn it over to Carlos Portillo and Maria Zavala from the LA County Department of Public Social Services. So take it away, Kiran.
Thank you, Jared, and thank you, Elise, and a big thank you to CFPA for inviting us to this party. Sounds like a fun one so far. I want to just highlight how we got involved in such a big way with CalFresh, with DPSS. We've always had DPSS at our WIC offices. I can't even remember how many years. We had eligibility workers come in, a day here, a half a day there at one of our over 52 sites. And it would be what I would call a sort of a routine, sort of a passive relationship. We used to meet at meetings at various places and, talk about how can we do more. But it was just something that was moving along. And then in 2015, Kim McCoy-Wade came to a WIC management conference and just really startled us all out of our passivity by reminding us that, oh my God, there are so many families out there who are food insecure, who are with us in the WIC program, and we need to really step it up and do a much better job of getting them connected to CalFresh. Until then, the WIC thinking, at least with us, had been, CalFresh isn't doing enough to refer people to WIC. So how many of you on this call are guilty of that? Raise your hands. Just as well I can see you, right? So after 2015 October, we had several phone calls, one with DSS, and Kim was on the call, connecting us to local partners who we already knew pretty well, but this really gave us the impetus to pursue them relentlessly to say, we need to do more, we need to do these connections better, what can we do? If you could please move to the next slide. One of the things that happened in our early relationship was they showed us their program reach index map, which kind of showed how many families in a particular area were eligible for CalFresh and how few were on the program. And the Catalina Island, as some of you might know from cruise ships and so on, actually has a very poor section in the Avalon area. And WIC, PHFE, has been going to Avalon for many, many years, once a month to provide services there. We saw this huge big red dot on Avalon. They had like maybe 2 or 3 families that were on CalFresh at the island. We had about 50 to 60 families on WIC, and we immediately said, come with us when we go to Avalon. Now, I will tell you, and Carlos and Maria will agree with me, that it's not easy to shake loose bureaucracy, but finally, after months and months and months of sort of relentless pursuit, we were very fortunate, and we were able to go to Catalina with several staff from our local DPSS office. And this just kind of shows you how we go there and come back. And if you go to the next slide, you will basically see what happens at Catalina. And this is how we kind of set up. It's a church setting with, a little bit of a space that a wonderful pastor's given us. We are sitting alongside DPSS. We take about 6 staff. We are there for just a few short hours. We advertise to people we're coming. They know we're coming. And the relationship was absolutely successful. So if you just click again, you'll see some numbers come on the screen. The CalFresh families went from 6 to 153 in 2017 in the 3 short months that DPSS was able to come to Catalina with us. What was even more amazing was the number of inquiries that they got was wonderful, and many, many more families are now connected to CalFresh because of this exposure and easy availability to DPSS staff. So this, as you know, success just leads to more success. And what this really meant was that DPSS started looking at us as viable partners. Next slide, please. We developed this flyer together with our CNAP partners in Los Angeles County, and this sort of became our mantra in our WIC sites, that people, all our staff started referring to CalFresh, and we moved on in the farmers market months of 2016 trying to get DPSS to come to the markets because we knew about market match. We have a different model for farmers markets in my agency. We actually go out to the farmers markets to give out the checks. Our redemption rates are wonderful. Families come to the markets, and we wanted to capitalize on the ability of market match where people could use their EBT cards, their CalFresh cards, week after week to get fresh fruits and vegetables. So the next piece of this is going to be taken away by Carlos, who's going to tell you how successfully they worked with us, and we worked with them. Thank you, Carlos.
Thank you, Kiran, and thank you for to the CFPA to inviting us to this important presentation. And as Kiran was mentioning, we're so glad to have these partnerships together with our WIC partners. I think it's very important for us to help each other to reach those families in need. So back in June 2017, I received a call from our WIC partners, and they called me with a really exciting idea to partner with them and participate at the farmers market with a campaign that they had put together. The only challenge was that that campaign was going to start in a few days. So as you can imagine, trying to staff and coordinate people to attend to these events was a challenge, but we were able to put it together, and everybody did a great job. Our outreach team was able to step in, and we were able to participate at 12 of the farmers markets that they had the campaign ongoing through mid-June and early July. In those events, we were able to sign up 785 people to CalFresh program. And we also were able to receive another 57 medical applications, which total 842 applications in less than, I would say, a month, during those outreach events. So what we learned in these partnership is that when we work together, many families benefit, and we were able to connect with some of the common participants that we have, both CalFresh and WIC. So as you can see here in a picture, we have our canopies ready. We do have our eligibility staff there who they're equipped with laptops and wireless connectivity, and they're able to take the applications on site. So we move to the next slide. Okay. So this is the number of families that were able to apply. And then here we have, a picture of our team. We're in the blue, DPSS, LA DPSS setups, and we do have a uniform that we utilize to kind of identify ourselves in the community as part of the outreach that we do, and we have our WIC partners here. So we go to the next slide. As you can see, we are, stationed next to each other. We were partnering with the Market Match WIC and our DPSS eligibility staff. And, this was such a great success that if you hit next, Elise, we were able to help over 2,000 inquiries that came through our booth during these outings. Those people would have questions about the program, and people that had, questions about how to apply and what affects me, what doesn't affect me, all those myths and misinformation that sometimes the community has. And we were able to, provide the correct information. So we estimated it in the events that we partnered with WIC, we probably saw about 4,700 people, come to our booth and, grab some information, besides those that were able to apply and take advantage of getting those services right in there. So with this successful partnership, we're getting ready to this year's campaign again and be able to work with WIC again and to try to enroll as many people as we can that come through the markets. So with that said, I'm going to hand it over to Maria to talk a little bit more about other partnerships that we have with WIC.
Good afternoon, everyone. Thank you all for having us here today to speak on this wonderful partnership. Being that Avalon and the farmers markets were so successful, it just opened up, to what next? What was our next endeavor along with WIC? So we collaborated, and we were invited to come into the WICs on Saturdays. WIC has a number of at least 15 offices, and any given Saturday opened up to the public to extend their services during the weekend. And we thought that falls right into what we believe of providing an alternate platform for the consumers to have access to our services, because it's very difficult sometimes for a person to take a day off from work and lose a day of wages or whatnot to handle their services. So what better than to have both WIC and DPSS together so that they can hit two birds with one stone in essence. So we focus on collaborating with these Saturdays by using the geocoding program reach index tool that pretty much gives us the areas where we have low CalFresh participation, and that's how basically we selected the Saturdays WIC offices to participate, to have DPSS staff come along. And it turned out to be very successful using the geocoding tool, plus a lot of feedback and keeping the lines open for communication and for feedback as to what worked and what did not work for a particular Saturday, and also to promoting that DPSS will be on site to take, the applications to provide on-site enrollment and assistance with any other inquiries that a consumer might have regarding DPSS services. And so we committed to going to 4 WIC locations a month on Saturdays. It's a semi-monthly effort, so it's 2 Saturdays a month. And from there, in the month of February, for example, I'm sorry, Elisa, if you can go to the next slide. So just to highlight the month of February, we helped 96 families apply for CalFresh during the 4 Saturdays. And we didn't stop there, but we also decided that we were going to extend the hours of service to those individuals, to those working families that could not, come into the office during a regular weekday. So we went on a Wednesday in February. And if you can go to the next slide. And so we explored having the DPSS Health and Nutrition Mobile Unit at WIC Norwalk on February 31st. And the highlight of this event was to extend the service hours from 11 to 6 p.m., like I said earlier, to offer working families an opportunity for them to get to the office and receive services. And again, it was an effort to have not only DPSS services, but also for them to handle their WIC inquiries. And this event in particular resulted in 43 CalFresh applications that day, and we provided assistance and information to about 122 consumers. And if you can go to the next slide. And that's the actual Health and Nutrition Mobile Unit with our staff. Like I said, we were side by side again with WIC, doing the warm handoff between our families and making sure that they receive the services that they went there for. And with that, I'm going to turn it over to Kiran, and she will wrap up our presentation.
Thank you, Maria. Thank you, Carlos. So just to kind of refer back, we are a very large agency. We have, we serve about 200 and some thousand participants every month. For the Farmers Market Nutrition Program, which happens in the summer once a year, families get up to $20 of coupons to use at the farmers market. And our model changed about 3 years ago, where we started going to the farmers market and families flock to the markets. Our whole goal is come to the market, get to know the market, and keep coming back, which is why it's so important to connect them to CalFresh so that they can come back every week and use their ABT card and get a market match, which happens in many of our markets in LA and in Orange County. So with 30,000 checks last year, we were able to draw a lot of families, which really helped support the numbers at DPSS. And I think it's that kind of a collaborative effort where, you got to think a little bit outside the box. Our staff had to get trained to talk to people while they were in line. We had to really allay fear. So people would say, no, I'm not really interested. And in a very gentle way to kind of say, well, do you have Medi-Cal? And most of them do have Medi-Cal. We'd say, well, the process would be a lot simpler because you already have Medi-Cal, so they have you in the system. And so many families were able to take advantage of this, as you've heard the numbers, which for us is just a sweet spot because these families are coming back to the market, which is what we hear from our partners in the hunger community that do market match. These Saturdays that have just been talked about, we advertise the presence of CalFresh heavily through our social media platforms, through texting to participants. We have a very interesting interactive texting platform, so we're able to reach out to people in a really wonderful way. They respond to us by committing to come, and we've got great stories of families traveling, if you know LA, from Culver City near the Santa Monica area all the way out to like Bellflower, which is way going towards the south. It's at least 40 miles just to sign up for CalFresh on a Saturday because the mom heard that CalFresh was at that particular site. So it's very heartwarming. It's, these few stories you hear here and there, and then you look at the macro. So many families are getting connected to CalFresh. And I want to end with the next slide, which is now we are in a position then, since we are doing so much good work with getting people into CalFresh, we are now changing the relationship and putting some pressure on our DPSS friends in LA to help us find those eligible non-participating families that Kim and Chris talked about. There's over 40,000 in just LA County. We have 7 different local agencies here. We've talked to our partners. Our goal is now to set up some meetings with CalFresh and talk about how can you help us find these needles in the haystack. And we've got lots of great ideas on how that could happen, and I'll save that in case there are questions. And with that, I'll turn it over to the organizers. Thank you.
Well, thank you so much, Maria, Carlos, and Kiran. And we do want to encourage attendees to please type in your questions. We've got a few coming in, but we've definitely going to be able to save some time to answer those. So please do submit those. But now I'm going to turn it over to another local county level partner, Tracy Barrow from Sonoma County. And she's going to talk about the success that they've had with memorandums of understanding to share data about likely dual eligible households. And Tracy has served as the WIC program manager for the County of Sonoma since 2007. And so without further ado, I will turn it over to Tracy.
Tracy, I think you need to take yourself off mute. Oh dear, hold with us while we have just the slightest technical difficulty. Tracy, we're unable to hear you.
While we work to resolve that, Elise, I can pose some questions that have come in to Kim and to our partners at DPSS, if you think that's okay. So this first one is for DPSS. The question is about those enrollments at the farmers markets, the CalFresh enrollments. Are those done? I guess this is for Carlos and Maria. Are those enrollments done at the outreach events themselves, or are they scheduled for a later date for a follow-up?
No, those are like we mentioned earlier, our staff is equipped with iPads and laptops and printers and everything that they need to do the enrollment on site. So the consumer, we take the applications for the consumer and the interview as well on site, and that's it. We take all the verifications as well that they might have with them and provide them all the information that they will need, if any, to further complete their applications.
So is it done right up to and including the interview as well?
The interview as well as collecting any verification that they might have with them at that time.
Great. And then a follow-up on that for Carlos. We had a question about the 785 CalFresh enrollments, and someone was just curious about what amount of time were those 785 enrollments done?
So we participated at 12 farmers markets. It was a total of 42 events that we participated in. The hours range from I want to say 4 hours.
4 hours, perhaps.
For each event. So, there was some events that we were averaging, 25 applications. There was one time in West Covina farmers market that we took 40 applications. So, based on the demand and the successful amount of people that had interest in applying for CalFresh, that's how the outreach team was able to, to staff the visits accordingly, to bring, enough eligibility workers to be able to take all these applications, during these visits.
Great. Thank you for sharing those details. Elise, do we have Tracy, or I can keep asking some questions if we're still having a delay there?
Well, Tracy, are you able to join us? I think we will have to skip Tracy's presentation unless she's able to join us. But if you have another question, go ahead. I also have some that I could ask.
Yeah, this one is for Kim and maybe Christine. Someone was wondering, they just said some of us only have access to enrolling into CalFresh. So would they be able to use the Welcome New Baby toolkit?
I'm sorry, Jared, I don't understand the question.
It just says some of us only have access to enrolling into CalFresh. So would they be able to use the Welcome New Baby toolkit? I guess they're asking, is that
I see what you're saying.
CalFresh specific? Yeah.
The vision is that it would be one message to a family that includes the right information for both programs, so that you would work, as we've just heard in Los Angeles, and we'll hopefully hear in Sonoma, the WIC and CalFresh agency would work together to determine what that right is. So for CalFresh, it might say, call our customer service center or log on here. And WIC similarly would need to figure out, is it a phone number? What's the right warm handoff that a mom who had a newborn who was interested in getting more information or even enrolled, where should she start? So the idea is that there would be both messages, but you're absolutely right. It's not expected that it would point people to the CalFresh agency to enroll in both, or to the WIC agency to enroll in both, unless somebody wants to pilot that. But it's really about taking that moment of communication, doing a joint communication, and then sending that mom to the right place for both programs, and that's locally determined.
Kind of a no wrong door toolkit. Here's a question which may require some follow-up with a link or something, but someone just wants to know, where can I find these geomaps? I guess that's for Kim and Chris. Does someone want to take
this is Chris from WIC. We have already shared the geomaps with the WIC local agencies, and I think Kim has the dashboard. Maybe Kim, you could provide more information on that.
Yes, from the CalFresh side, they are posted on our CalFresh data dashboard. The best advice I can say to you is to Google CDSS CalFresh data dashboard. And of course, I'm sure CFPA would be happy to send out the link, but it's a long link.
You read my mind.
The data dashboard, the maps are under the geomaps button, and the bar charts are under the dual participation button. But that's a public CDSS website. At this point, we're sharing aggregate data with all stakeholders, counties, outreach partners, and the public. I think the question everyone's looking for is that individual list, and how can we go further, as Kiran rightly said. And so that's something we're looking at that would be, need legal protection, as Sonoma has arranged, and then would be shared directly and privately. But in terms of the aggregate level data, that is on our webpage.
Great. So we'll be sure and send that link out to attendees in the follow-up to the webinar. Thanks.
Jared, I have a question. I think this goes to Kiran and PHFE-WIC. How does WIC envision DPSS helping you reach those 40,000 eligible, not participating potential WIC children and infants?
Thanks, Elise. Well, we have lots of ideas, of course, and we have to figure out what all we can do. Well, first of all, we really would like exposure, more exposure to all the eligibility workers. One of my colleagues, Denise G., who I have to give a big shout out to because she put all of our slide deck together, she had a quick opportunity to talk to eligibility workers and really talk about the importance of referring families with children under 5 to the WIC program. That was very good because when families go back in for recertifications, that's a really good time for them to be reminded about the WIC program. And you have to do it with a little bit of passion. So using the WIC and CalFresh Better Together flyer in all of our sites, including DPSS, is a really good way to do it. We're also looking to see if we can have some of our staff actually be at some DPSS sites so that we can be doing some more advocacy and finding people there. But the actual biggest reach out we want to talk to DPS about, and we actually have a meeting set up for next week, is how they can either text out or reach out to their families who have children under 5. And we're looking at 3 different strategies. They can either do an implied consent. We think that would be easy to say, hey, you qualify for WIC. Would you like WIC to reach you? If they say yes, I would think that's consent, so we can get their information. The other idea is to send these families via text or other methods a short code that they could be texting to us, implying interest, and then we would do the reach out and find them. And then the third and the most convenient way really might be to send them to our website, which has a very easy apply button. Now, we do believe that it takes a little bit more than just letting people know they're eligible for WIC, because with our retention issue, it's a lot of families who are choosing not to participate because, as one of the important people in CDPH said, the juice is just not worth the squeeze when it comes to the WIC program, which is why we rely on our CalFresh and WIC Better Together flyer in such a big way, where we can make families understand that the importance where everybody wants to give healthy foods to their families, start with WIC, because WIC only gives you healthy foods. Our messages are so powerful because they are carried through in the foods that families buy. And then we go on to say, and then use your CalFresh dollars to get you the healthy foods that you don't get enough from WIC, like fresh fruits and vegetables, like whole grains, like the corn tortillas, like more yogurt, and then use your CalFresh dollars to buy other nutritious foods like meats and chicken to make those healthy soups and meals for your family. So if we can keep integrating those messages, we think that we could really, really be better together. And we're hoping for good leadership from both the state and our local partners. And lastly, we have a very crazy idea that we could probably start getting our families in the WIC program if we got some outside funding to enroll eligible families into the Your Benefits Now network, the YBN, which is really taking off in LA. And once families get onto that platform, they're connected so well so that their SARs, their semi-annual reports can be done by them. They could do their certifications. They could upload documents. I'm just looking for someone to fund us for a little pilot, and that would be great.
That's great, Kiran. Thanks so much. Tracy, I think I'm going to take one more try. I think I've seen you rejoin. Are you there?
Yeah.
Are we able to
Can you hear me? Can you hear me?
I can. Fantastic.
Yay.
We would yay. We have about 7 more minutes.
I think it kicked me off. I can do it quickly.
Okay. So take your time. Go ahead. Thanks.
I am just impressed so much with Kiran and PHFE and the Los Angeles County program working together. It's so impressive. Thank you so much for inviting me on the panel. I'm here today to report about the MOU, our county health services WIC program, which I represent, and our county's human services CalFresh program have come together. We realized that many of our county children were enrolled on what we call in the WIC language is adjunctive eligibility government programs that made them income eligible for WIC, but they were not participating in WIC. And so with that goal, to reach those families, an MOU was written that would allow Human Services Department, who had the CalFresh, Medi-Cal, and what we call Sonoma Works programs, to release the names and contact information for the children in Sonoma County 0 to 18. Of course, we're focusing on 0 to 5 for the WIC program. And with that huge list of names, I did an Excel spreadsheet and then added our WIC. I ran a WIC report with our children 0 to 5, and then I sorted it by date of birth and found the matches, which is great. That means they're dual participating in all the programs. But I also found the groups where we didn't have a match, and that's our targeted outreach campaign. It's a very tedious task going through the information and trying to sort out. But we plan to send out generic postcards to this targeted population, just stating that they're about the WIC program and they might be eligible if they participate in any of these programs. And we just got the most recent updated list, so we are going to start in April and get rolling on this. We're going to target our 0 to 1-year-olds at first, so we'll get those moms and those babies onto the WIC program, postpartum moms. And it's pretty exciting, but again, I'm like Kiran. I would love to have some funding to help pay for the postcards and the labor to go through all these lists and, you know, get this gap of people who aren't participating in both programs. We too also have linkages with CalFresh. 3 out of the 4 WIC clinics have enrollment counselors co-located with our WIC staff, so makes it very nice to cross-refer on a daily basis. And then last but not least, which Kiran talked about, we have our own WIC summer farmers market in our parking lot. And we have that market match thing that goes on. And as well as those application enrollment counselors are also out at our farmers market at a table every week, catching those WIC families that receive the WIC summer, farmers market checks, specifically to farmers market, and catch those families walking over to the market. So we're doing quite a bit. We're not doing enough, but we're doing quite a bit of trying to match the CalFresh audience and the WIC audience, or the WIC participants. And that's all.
Thank you, Tracy. So we have about 4 minutes left for questions. I think I have one more good one for, well, they're all good. I shouldn't say that. I have one more for Kim, if you would answer. What are the barriers to InReach projects like the ones you discussed succeeding?
Well, I think everyone's interested in what Tracy just mentioned about making sure you're targeting as much as possible. So we're very interested in exploring the data sharing agreement that Sonoma has to see if we can make that easier. But I think the other thing, and Kiran mentioned this, is, as did Tracy, we all want to go beyond referral. We don't really think the barriers for families are knowledge of our 2 programs. We think it's that customer experience of making it easy to enroll and retain for eligible families. So really thinking about, if you do get that funding for the postcard, the flyer, or the text campaign, making sure it's the warmest handoff that leads all the way through the funnel to enrollment. So is it the best phone number? Could the person where that phone number calls, does that phone get answered quickly? Can the person do complete service, whether it's a whole application for CalFresh or scheduling for WIC or whatever the right is? Is there a web link that a person could initiate an application? Is it interactive texting? But I think, you know, the targeting is a really key question, and then the specific intervention that goes beyond referral to net that enrollment is where we're really looking for counties and local agencies and stakeholders to break some new ground.
Great, thank you, Kim. You know, I have one more follow-up question then for Tracy. Was it difficult to start the conversations with CalFresh, this idea of discussing the idea of sharing information?
Well, that's a great question. What happened is someone moved from our health department who had actively worked with our program, and she moved over to human services department, you know, that personal connection. And she's the one that got the ball rolling. She knew me, and then she knew that side and got us at the table talking. And sometimes that's all it takes, is someone that, you know, is respected and, you know, gets it going. And then the question was, well, why can't we do this? We can do this. So it took a while, you know, of course, in government, getting the MOU ironed out, and we finally got it completed and done. So it was worth the wait.
Great. Okay, so I think we are at time. I want to say a big thank you to all of our panelists for being here today, for your presentations and answering questions, and everyone on the line for joining us on today's webinar. I hope you will check out CFPA's website for more information, and we certainly will have updates there. And please do feel free to send any questions for myself or any of the panelists to me at elise@cfpa.net. Thank you so much, and goodbye, everyone.